Hi, good evening. My name is Dr. Amy Amin. I'm a pediatrician here at CareMount, and I practice out of the Jefferson Valley office. Tonight, my hope is to talk about healthy living throughout the years, from birth until adolescence, and to kind of feed off of Dr. Need's talk that she just had about media. So healthy living, when we think about healthy living, there's so many different aspects of it. There's three things that I'm going to focus on tonight, given different age groups. So the first one is nutrition, the second one is exercise, and the third one is sleep hygiene. And so starting from birth, all of us as pediatricians focus on, from the time the baby is born, introducing whether it's breast milk or formula. If they're breastfed babies, we do harp on the importance of vitamin D and making sure a baby is getting vitamin D as a daily supplement if they're breastfed, because vitamin D is excluded from breast milk. Breast milk is wonderful, except for the lack of vitamin D. And so from infancy, then going through, when a baby reaches about 4 to 6 months of age, that's when we'll start noticing if they're developmentally ready to actually start solid foods. So for example, as long as a child exhibits really good head control between 4 to 6 months, then we'll give the parents the go-ahead to go and start pureed foods. So whether it's fruits, whether it's vegetables, whether it's iron-fortified rice cereals or oatmeals, as long as that child is exhibiting good developmental head control, then we'll totally approve that they start on the foods. We do talk about the importance of spacing out new foods. So for example, every 3 to 5 days introducing a new food, which allows parents ample time to see if there's an allergic reaction. So whether it be hives, whether it be facial swelling, vomiting, diarrhea, etc., which are not common with pureed fruits and vegetables, more common with the highly allergenic foods such as peanuts or eggs that happen later on during their developmental years. With that caveat also, we'll also encourage parents to delay the introduction of juice. So juice is something that is, even if it says 100% organic or natural, it's full of sugar. So our whole goal is to make sure we reduce sugar intake at a young age so they're learning healthy habits as they get older. So it becomes secondary and inherent to them as they grow older. Water gets introduced at a young age as well, so as long as a child is starting meals, we do encourage water intake as well. It's important to figure out whether a family has city water versus well water, because well water lacks fluoride. Not all city water has fluoride, and the importance of that is to make sure that we as pediatricians are then going ahead and prescribing a multivitamin, which includes fluoride, to help prevent future cavity development in their teeth. At around 1 year of age is when we'll talk about the introduction of whole milk. So whether it's they're going to continue breastfeeding or they'll transition to milk. A lot of parents do ask, especially those that are have their children on formula, can they introduce whole milk earlier? The whole reason to not introduce whole milk earlier is to help prevent iron deficiency anemia, because the calcium in the milk actually does block iron absorption. So holding off until 12 months is really important. That goes along with when we check their actual hemoglobin levels. So to see, are they anemic or are they not anemic? So the two kind of go hand in hand together. Around a year of age too, then we talk about, well, before then, between like 8 and 9 months, when a child starts to display a pincer grasp, which is where the first digit and the second digit come together and they start to pick up little small objects, then that's when it's really important to start table foods. Why? We want to graduate them from pureed foods and also have them learn their fine motor skills, which is really important for them understanding and trying out different foods. And as time goes on, they're becoming more independent eaters rather than us feeding them and sitting there. So besides nutrition, when they are young, we also do discuss the importance of sleep hygiene. So recently, in this past year, the American Academy of Pediatrics came out with a recommendation recommending all infants should stay in their parents' room until a year of age. Prior to that, it was until around 6 months of age. So there is a bit of controversy over the new recommendation in terms of children staying in the parents' room until a year of age. So we as providers still say that it's okay at the 6-month mark they are developmentally able to self-soothe even at 4 months. So parents can definitely start learning to sleep train their children at a young age, and then with hopes of graduating them out of their room into a separate sleep environment. That way they're learning to self-soothe on their own, and they're learning that they're in a safe environment and they're going to be fine. And with that being said, newborns usually sleep around 17 hours a day, which includes the brief naps that they take during the day and the overnight periods. And then eventually around a year of age, that decreases to around 14 hours a day. We can't, of course, force every child to sleep the given hours that are in the textbooks and that are written AAP websites. However, that's kind of the generic goal or the general goal for all the children. As they graduate into being 1 to 3 years of age, they do sometimes become picky eaters, right? So picky eating is a huge topic of conversation that comes up during well visits, and it kind of haunts a lot of parents. The key part, and this is to kind of feed off of one of Dr. Need's main messages, is making sure we always maintain a positive environment. So Dr. Need talked about positive reinforcement, and that goes along with also feeding, nutrition, and sleep as well. So for example, if we have toddlers who are picky eaters, the whole point is to make sure is that we're not constantly forcing them to finish everything that they're picky about. So for example, if their dinner is pasta and we know they enjoy pasta and they're really picky about the broccoli, then try to come up with some compromise that if the child takes one piece of broccoli, then you can get the main dish which you enjoy. The more times the food goes into the mouth, studies have proven that they're more apt and more likely to actually taking it and trying it. Sometimes it can take 12 times, sometimes it can take up to 40 times, depending upon whether the child has a history of sensory processing integration disorder or any other behavioral issues or medical conditions that prevent them from trying food. So is it important to be persistent, but in a positive manner? For sure. Other things too, which is really important even from infancy through the toddler years, is learning to establish family mealtime. So often these days, parents are working late, families are not together for dinner, and dinner is a main meal where families can sit down, and it's really encouraged that it's a great time for families to go around the table, share what's a positive part of our day and what's a negative part of our day. So they're seeing too that there's ups and downs to adults' lives and also to their lives. So they learn resilience through those conversations as well. So that's really important. And it's important to make sure there's no screen involved in mealtime. So using a screen is distracting them from focusing on what's important, which is developing social skills and developing relationships with their parents and their siblings. And so it's important for them to also enjoy eating and enjoy the foods that are in front of them rather than using the screen time as a primary distractor and food is just hey, we got to get through this in 10 minutes. It's going to be fine. So trying to encourage a setting where we promote conversation during mealtime is really important. It'll actually probably spark their interest in terms of appreciating sitting down and eating, and they're more apt to eat healthier meals when everybody's eating around them because they'll eat through observation as well. So if they see that their older siblings are eating healthy meals, then younger ones are more likely to try different foods as well. That being said, also during the toddler years, sleep definitely changes. So they are napping during the day. And so from around between 1 and 3, they take about 2 naps a day. Overnight, we're encouraged to still do about 12 hours of sleep overnight. If they are during the day having difficulty sleeping or napping, by no means is it forced time. So you can always do quiet time, which means reading books together, playing with toys in a quiet corner. So that way they're understanding there's still downtime during the day, which is healthy for us to kind of regroup. Other things too, in terms of the toddlerhood years, is them having different forms of activity. So that means structured and unstructured play. So Dr. Need mentioned how board games are great and so true. So it gives an opportunity for the kids to have a dynamic with the family. And so that's more of structured play, where kids are going to be given directions and they have to follow them and understand them. And then there's also a real heavy importance on unstructured play, which allows kids to utilize their imaginations, and so that they are actually learning independently as well. So both types of play in the toddlerhood years are really, really important. Physical activity, the best way to encourage toddlers to get involved is for parents to get involved. It goes hand in hand with Dr. Need's recommendation of using media together instead of having parents separated from children. So the same goes with physical activity. So whether it's biking together as a family, hiking together as a family, playing soccer together as a family. So if children see their parents appreciating something, then they can develop an inherent appreciation for it as well, and it becomes second nature. So if they're used to, at a young age, exercising daily, when they're older, they don't question it. They're used to it, and they say, oh, this is normal. So whatever normals we develop at a young age, and that's why the whole part about modeling healthy behavior when children are young is so important for as they grow up, what healthy habits they develop. It progresses into when they're a little bit older. So when they're 3 to adolescence, it's really important in terms of nutrition to involve them in the actual process of making or growing the food. So for example, some ideas to encourage healthy eating are to actually have a garden set up together. So that way children are understanding, where does the food come from? How is it actually processed? How do we go ahead and make it? And if they're involved, that actually kind of it cultivates their curiosity and their interest in the food. Also, if we try to jazz it up and be a little bit creative, so that means like making little animals or smiley faces out of the fruits and vegetables, or cutting their sandwiches in different shapes, or asking them to be creative about how the meal's put together, they're more likely to, when we tap into their interests, then they're more likely to be vested in actually making healthier decisions for their nutrition, which is really important. Even when baking or when cooking, so even simple tasks like asking them to stir things or pour the different, like if you're making a pizza dough, asking them to knead the pizza dough, just so they're getting involved and they're more excited about it, which means that they're probably going to be excited about eating their products that they make. So that's why really important to make sure you collaborate together as a family and involve them and loop them in. Important also that as they're getting older, to make sure that other things too in terms of snacking. So commonly we'll say, oh, you can make sure kids are not grazing all day long. So like 1 to 2 snacks a day is the ideal, and the ideal is 3 meals a day, right? So them learning that they're just not going to sit there all day long and every single hour pick up a snack, and teaching them what are healthy snacks versus what are unhealthy snacks. The key part is also to give them options, right? Because we're trying to exercise their independence in this as well. So if we give them 2 options, they feel like they're in control of the situation, which is really, really important. And then physical activity, this is the age like after 3 years old where you can start to get them involved in organized activities. So when they're a little bit older, whether it be soccer, whether it be a swim team, so they're learning not only self-esteem, they're also learning team dynamics, and it's natural form of exercise, so they don't feel forced to do it. So that's really important as well. As they grow into adolescence, the big thing about healthy living ties into media use. So as adolescents, media use has become, fortunately and unfortunately, a predominant part of their lives, right? Their social lives depend on media. Video games, they actually hook up wirelessly to all their friends and play video games together, whereas back in the day, you used to play a video game on your own at home. So everything is very tied to media. So with adolescents, it's really important to make sure we encourage them still that the recommendation is 60 minutes of exercise every single day, and it being cardiovascular exercise. So them understanding that there are certain limitations on media use in order to promote physical activity. So, for example, during the weekdays, we'll talk about try to achieve 1 hour, and then on the weekends, maybe 2 hours. And this is where that plays into having a media contract in a home environment as well. That being said, adolescents are very busy academically as well, so sleep hygiene is really important. And studies have shown if there's a lack of sleep hygiene, that increases the risk of obesity and being overweight as they get older. Are we seeing increased rates of type 2 diabetes and metabolic syndrome when they're older? For sure. So ensuring that they're physically active, but at the same time they're sleeping well is really important. So still recommendation is about 9 hours of sleep every night. And encouraging that screen time is not part of their turning down time, so that there's a routine before bed, and about 1 hour before bed, it's either reading something or listening to soothing music, so that way they're not being stimulated by a screen, whether it be an iPad, a phone, a computer, and they're allowing their brain to kind of turn down and turn off for the night is really vital. One wonderful resource, which I think we use the same things, is healthychildren.org. So the American Academy of Pediatrics is really a great resource through that website. And it literally will walk through parents from birth until through adolescence, through age 21, when we stop seeing patients, in terms of recommendations for their sleep, their nutrition, and their physical activity.